Good day everyone. Welcome to Teacher Julie channel. Hello everyone. We have our new lesson in MAPEH 7 for Physical Education and Health, which is all about first aid procedures for managing common conditions. This will be the fourth quarter topic and learning competency number 1. This lesson is under the MATATAG curriculum. For the objectives, by the end of the lesson, 80% of the learners will be able to. First is to identify the signs and symptoms of common medical emergencies. The second one is to practice applying bandages, splints, and other first aid treatments. And the third one is to recognize the importance of remaining calm and taking immediate action in medical emergency by answering the reflection of learning. In activating the prior knowledge, for the short review, the students will write if the statement is true and if the statement is false. The following are the first aid procedures for managing common conditions. For the bites, the signs are the visible bite marks, swelling, redness, pain, puncture wounds, and bleeding. For the symptoms, pain, localized numbness or tingling, itching, inflammation, fever in some cases. For the first aid management, you need to clean the wound with soap and water and apply an antibiotic ointment and cover it with sterile bandage. So seek medical attention if it is severe bite or if there are signs of infection. Another first aid procedure is the wound. So the signs are open skin, bleeding, swelling, redness, presence of foreign object. And for the symptoms, pain, tenderness, warmth, pus or discharge, fever if the infection happens or develop. For the first aid management, you need to clean the wound with mild soap and water, then apply pressure to stop the bleeding, and cover with the sterile bandages or clean cloth. Seek medical attention if the wound is deep, large, and shows sign of infection. Another first aid procedure is the burn. So the signs are redness, blistering, swelling, charred or blackened skin, and peeling. So the symptoms are pain, tenderness, difficulty moving, shock in severe cases. So for the first aid management, so burns, you need to cool the burn under cool, then running water for at least 10 minutes. So cover the burn with the sterile dressing and seek medical attention for severe burns. Burns to the face or burns that cover a large area of the body. Another first aid procedure is the bleeding. So the signs are visible blood, bleeding from a wound, blood pooling on the skin or ground. And the symptoms are weakness, dizziness, lightheadedness, rapid heartbeat, and low blood pressure. For the first aid management, you need to apply direct pressure to the wound with a clean cloth or bandage. Elevate the wound if possible and continue applying pressure until the bleeding stops. And you need to seek medical attention if bleeding is severe or cannot be controlled. Another first aid procedure is the fainting. So the following signs are loss of consciousness, pale or flushed skin, sweating, shallow breathing. And for the symptoms are dizziness, lightheadedness, blur vision, nausea, and confusion. And for the first aid management, you need to lay the person flat and elevate their legs, loosen any tight clothing, and provide fresh air. So if the person does not regain consciousness within a minute, you need to seek medical attention. Another first aid procedure is the poisoning. So the signs are nausea, vomiting, abdominal pain, diarrhea, sweating, and difficulty breathing. The following are the symptoms: dizziness, headache, weakness, confusion, seizures, loss of consciousness. And for the first aid management, so call poison control immediately for guidance, and you need to remove any contaminated clothing and rinse the affected area with water if appropriate. Then you need to seek medical attention if the symptoms are severe or if the substance ingested is toxic. Another first aid procedure is the choking. So the following are the signs like inability to speak or clenching a throat, and cyanosis. And the symptoms are gasping for air, wheezing, coughing, panic, and loss of consciousness. And for the first aid management, you need to perform abdominal thrust to dislodge the obstruction and to encourage coughing if the person is able to cough. And you need to seek medical attention if the obstruction cannot be cleared. Another first aid procedure is the hyperventilation. So the following are the signs like rapid breathing, deep breathing, chest pain, dizziness, and tingling in extremities. The following are the symptoms like shortness of breath, feeling of suffocation, numbness, or tingling in fingers or lips. So for the first aid management, so you need to encourage slow breathing, breathing into paper bag if available, and reassurance. So remove the person from stressful situation if possible, and seek medical attention if the symptoms persist. Another first aid procedure is the heart attack. So the following are the signs like chest pain or discomfort, shortness of breath, nausea, lightheadedness, and cold sweat. The followings are the symptoms like pain or discomfort in arms, back, neck, jaw, or stomach, fatigue, and anxiety. For the first aid management, you need to call emergency services immediately and help the person rest in a comfortable position and assist with any prescribed medication such as aspirin. And you need to monitor the person's vital signs and be prepared to perform CPR if necessary. Another first aid procedure is the stroke. So the following are the signs like sudden numbness or weakness in face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, difficulty walking, and severe headache. And for the first aid management, you need to recognize the signs of stroke such as the face drooping, arm weakness, speech difficulty, time to call an emergency services. So keep the person calm and comfortable and provide reassurance while waiting for medical help. For the work example, the students will answer the activity called the First Aid Explorers Journeying Through Common Conditions.